Welcome, everybody, to the Recovery Connection, episode number 5. I'm so glad you can join us. We have new cameras here, so I don't know which camera I'm supposed to be looking at, but I'll go with that one that's right over there. Welcome to the Recovery Connection, a podcast focused on plugging in Ottawa's recovery community. Please join us live on Facebook if you're not already there, and YouTube at 8 p.m. on the second and fourth Thursday of every month, where I will be chatting with friends in recovery and community organizations on topics that are important to not only us, but to all our local communities. So if you're joining us live tonight, send in your questions at the end of the podcast for our question and answer period, which I thoroughly enjoy. Sometimes the guests don't, Kate, but I thoroughly
have to do all the
enjoy
work.
it. The Recovery Connection is available on all our major streaming platforms such as Spotify and Google the week after the live episode, so you can listen to the beautiful edited edition that John does. And please follow us and like us and share us on your social media accounts to stay up to date on upcoming conversations, upcoming guests, and news that we may want you to know. And visit us at our website at www.jerichoroad.ca. I like saying that really quick. www.jerichoroad.ca to learn more about Jericho Road and what's going on in our community. Now, let's get right to it because I'm very excited. Today's episode, we have Kaite Burkholder-Harris from the Alliance to End Homelessness. Now, I'll be up front with everybody. Jericho Road is a member of Alliance to End Homelessness. And so we got to know Kaite and the Alliance 2 years ago, I guess.
Yeah, that's when I started.
Yeah.
March 2020.
March 2020.
Heck of a day.
Why does that seem so long ago, eh? Good golly.
Yeah.
So I guess I'm going to start off with just asking you, Kaite, what is the Alliance to End Homelessness and how long has it been around and what you do there?
Yeah. So, well, it's very exciting to be on episode number 5. I feel like I'm under the 10, so it feels very exciting.
Yes. In the importance rating, right? Yeah.
Yes, exactly. Right. Top 5. That feels awesome. So the Alliance actually has been around for, I think, almost 30-40 years. It actually was something, so we only learned this last year as we were sort of digging into the history, but in the late 80s a lot of service providers and the city actually got together in Ottawa and they started to see this need for increased homelessness was starting to happen. It was becoming more visible. And so a number of activists got together in agencies and said we need something that's really focused on trying to end homelessness and that advocates for people experiencing homelessness. So they started out, I think, as just sort of a group or a network, mostly to support each other and then also to do that advocacy, especially with the city and the province. And then over time, it had become a full, I think, incorporated nonprofit in 2010, but has really, I think, since the early 2000s had a pretty strong name because it was a lot of researchers that worked with community agencies. And a lot of what they did was this thing called the report card. And that's sort of what put the Alliance on the map. So it's this whole thing of basically just assessing how are we doing as a community in Ottawa on homelessness and looking at the data. So between that and there was sort of once a year giant forum, like community forum, where all the sort of social service providers got together. That's sort of what the Alliance did for a lot of its kind of history.
Now, when you say social service providers, give me an example.
Sorry, I'm
That's
slow.
Okay.
having a sip. So a lot of it are community nonprofits. So community, everything from housing providers and nonprofit housing to obviously the shelters are all a part of it. Looking at having more folks who work in the violence against women sector. And now we're at almost 70 different agencies across Ottawa. Yeah. And so I think the Alliance has become a really big voice to be able to advocate for people experiencing homelessness and with people experiencing homelessness. That's become a huge part, is making sure folks who have been on the street are part of our board, part of our staff teams, and really helping to lead and to inform the kind of work that we want to do.
Yeah, beautiful. So, you and I had talked before the podcast. We have a little pre-podcast chat. And one of the things that I wanted to talk about was in 12-step recovery, we always have this saying, problem, solution, plan of action. And so what do you really identify as the problem? I know there's many issues surrounding it, but What would you think is the main issue surrounding homelessness right now in the city?
So I actually think now it has become a lot more complex than what I think the core of homelessness is. And I look at it like this, a lot of what we talk about are, let's say the classic things people speak to, right? Why are people homeless? Mental illness,
yes,
substance use, those sorts of pieces, family violence, family breakdown. And I think what's really important is to look at the data and the fact that those things have existed as long as humans have existed because we're human. But mass homelessness, what we see now with 235,000 Canadians a year experiencing it, and that's just who's recorded, that really didn't exist until it started to happen in the late 80s, early 90s, and by early 2000s, we'd hit this astronomical number. And the same thing that happened during that time was the federal government basically completely cut off funding nonprofit, purpose-built affordable housing. So
what type of number are we looking at in Ottawa?
So in Ottawa, we see about 8,000 folks a year who experience homelessness. Interestingly, I think because people were not going to the shelters this year in the same way, one, there was a moratorium on evictions, so people weren't getting kicked out as much. And also, I think people feeling afraid of the shelters to some degree, despite best efforts, more people outside. The numbers are going to be lower this year, even though COVID, you would think it might be even worse.
Yeah, it might be have the reverse.
Yeah.
So one of the things that I always say is there's an intersection that we see of homelessness, addiction, and mental health, and how those three things really occur together quite often. And so how do you see those three things occurring with homelessness?
Yeah, and I think, you look at the history too, and you think when community institutions, or when they stopped kind of having any kind of mental health institution, people were discharged and didn't have safe housing, affordable housing. And I think that's a big part of it, in that, somebody's experiencing mental health issues or experiencing substance abuse, and without having access to affordable, safe housing, it becomes that much harder to recover and to find healing. And so,
to continue that journey that they're on.
Totally.
Yeah.
So I think starting at, everybody needs like that basic piece of, I need a safe place to stay.
Yeah.
I'm not going to be able to get better necessarily in the shelter or sleeping alone at night.
Yeah.
But having that safety, I think, is a really key piece.
Yeah. On a previous podcast, we were talking about survival mode, right? And how exhausting survival mode is.
Yeah.
And how it's hard to accomplish anything when you're in survival mode.
Totally.
Because all your energy is going towards keeping that roof over your head.
Yeah.
Yeah. And so your focus is just on that. And so doing anything else becomes nearly impossible.
And I often think people aren't aware that homelessness and poverty are a full-time job.
Yeah.
It is beyond a full-time job. It's 70 hours a week. You're trying to survive. And the thing I hear a lot from folks is, I'm just walking. Yeah. I'm walking all day.
Yeah.
There's nowhere I can sit. There's no public spaces where I don't get moved along or shuffled along. Services are only opened at certain times a day. So there's that part of just having to constantly be moving. And then there's this other part of trying to get things, go to this appointment, get this referral, go to this appointment. Yeah. And, without the safety and consistency of okay, but I get to go home at night. I get to have a safe space to do all those other pieces.
Or for the mental aspect of that alone, knowing that I do have a safe home or a safe roof over my head to go to.
Yeah.
Right?
Yeah, exactly.
I know we don't want to really point fingers or anything, but you and I did have a brief conversation on the change in government services, not only in Ottawa but provincially, federally. Do you think that we're on this train where government services are slowly being eroded?
So I think that, and I'm glad that we did have a early interview before this. I think that, the bureaucracy that gets in the way of helping people, we understand why it exists. We understand when you're using public funds, blah, 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 you have to be cautious with that. Like, that makes sense in some ways, but I think it's gotten to a point where we don't see the goal and we don't see the person. Yeah. And so, as you and I were chatting before, it's not just the fact that there's, steps and steps and steps that a person has to jump through when they're in a state of survival and crisis, right? Like, it's, here's a referral, fill out this form, fill out this other form that says the exact same thing, but slightly different with a different font, right? Like, the level. And I just think, my goodness, I can't, like, if I call Rogers, I lose my mind. Like, this is ridiculous that this is what somebody in a crisis is going to have to do. And so I think that's something that's a culture shift that really needs to happen in how we design serving people at a system level. Is we need to start thinking about it as, like, every step that we add to this process is one more step likely that a person's going to not be able to keep going. It's a barrier. Every step becomes a barrier.
Or become disenfranchised in having to do that. Yeah.
And I think when you start to see cities that are succeeding in reducing homelessness, this is one of the key things that they focus on. So a good example is, and I'm going to forget what the acronym stands for, but the EPIC program in Toronto. Yeah. So it's an evictions prevention intervention coordination, I think. So if you called their city, so 311 in Toronto, and you said want to get into the EPIC program, you are transferred to somebody who can actually get you money to prevent you from, losing your place in 6 minutes is the average. Like 6 minutes of, I'm in a total housing crisis, I'm about to get kicked out, okay, we have some funds that we can support you with. If it's arrears, we can navigate or negotiate with your landlord, and somebody is on the end of that phone who has enough authority to actually be able to help, rather than kind of pushing it up the chain until you talk to somebody, which, as we said, wastes everyone's time. And it just becomes all of these barriers for somebody to be able to really, like, survive in a lot of ways.
And the whole idea is to take those barriers down so that the process becomes a lot smoother and it becomes easier for someone to accomplish what they need to get done.
Totally.
One of the things that you were just talking about, I want to talk about your Open Ed article that was in The Citizen. And I made a few highlights because one of them you just talked about, where was it? Just give me a second here. Where was it? Was it out west or something where they were having this program that was working well, and that their rate of homelessness per 100,000 people was really low. I can't remember. We'll come to it. The first thing I want to talk about is in this article. It says, we ask you to rethink how you look at the people in your community experiencing homelessness. And that hit me. Yeah. Why is that important?
So I am not the person behind that article. Yeah. It is 100% the team of folks with lived experience that we've hired, the expert steering team. And they wrote this op-ed. And
we should give them their credit. It was Benita Aurora and Sophia Kelly-Langer. I hope I pronounced that right.
I think so. Sophia Kelly-Langer on behalf of the whole team. But they did a fantastic job. And I agree. I read a lot of pieces of this, and it just was like a gut punch every time you read it.
So that was the gut punch for me. Yeah. We ask you to rethink how you look at the people in your community experiencing homelessness. Yeah. So it's a new lens, right? So what lens do most of us?
Well, do we see somebody with any lens? There was actually a U of T or a Ryerson study that showed the part of our brain that lights up when we engage with another human being. When walking by people experiencing homelessness who were panhandling, that part of the brain was not lighting up. And I think, what does that say about how we are thinking, like unconscious bias or not, but how we're actually thinking about people in poverty experiencing homelessness?
The thing that I was thinking about also is the conditioning. Yeah. What have we done to ourselves to condition ourselves to walk over that person's legs on the sidewalk?
Yes.
Without batting an eye.
Yeah. And that's become normal.
And that's the norm. Yeah. Right?
Yeah. And I want to it's messy stuff in that I do have sympathy for the fact that, I think especially when someone's panhandling, like people feel awkward, right? We don't know how to engage. People may not be as informed. They may not know what to say or what to do. And I, to be honest, feel like a bit of a jerk sometimes saying hello when I can't support with money if I don't have any, if I don't have like, I don't know, a cigarette or something of value to help. And so I feel like a bit of a jerk to be like, this person doesn't have to talk to me. Like, I'm just a whatever. Like, this person has no need to talk to me. But I also think it's that idea of just being a human. And if that other human's like, I don't want to talk to you, then that's also fine. But I think that idea of somebody being recognized, being looked in the eyes is valuable.
Yeah, that's one of the things that we always say in recovery is sometimes I just want to be heard.
Yeah.
I just want someone to hear me.
Yeah.
And I get that.
Yeah.
I get that. Another point in this article, it said, when does your neighbor become your neighborhood problem? Ouch.
Yeah. Yeah. And I think a lot of what this group was really wanting to address, I think, is the stigma and the vitriol that in particular has come about during COVID, where I think more people have been home, more people have seen more folks on the street who are homeless, more people have been desperate and staying in encampments. It's increased visibility. People just not having social services to go to during the day or programs. There's no public washrooms.
Or the services are reduced drastically.
Exactly. And so people are seeing more folks, but also I think some have been extremely positive and trying very much to be supportive and donating and trying to do caring things. And then you also see this backlash, right? This huge amount of backlash that started to come, being very, very critical, very stigmatizing, language that is just dehumanizing in the most significant way about people who are experiencing homelessness and in the market in particular. And I think also towards social services and social service staff, we've heard lots of stories about neighbors actually like just yelling at people on the street who don't have anywhere to go. So I think it's that idea that are the people who are in your neighborhood, whether they have a house or not, are they actually residents? And I would argue that yes, they are residents.
So I'm going to give you my experience with this. So I live out in the suburbs. I live in Barrhaven, and we were out shopping, and I was with a friend of mine, and we came up to a major intersection, Stranraer and Greenbank Road, and there was someone who was panhandling at the intersection. And my friend looked at me and said, well, when did this happen? And the first thing I thought was, what does he mean by when did this happen? Because he is a part of our neighborhood. He doesn't live downtown. He wouldn't come from downtown to Barrhaven
to Stranraer
to Stranraer and Greenbank Road to panhandle. So he lives here. So he's a part of our neighborhood. And then reading this gave me the big light bulb moment. He's our neighbor. He's not just a part of the neighborhood. He's our neighbor. And so, there is that it's almost like a classification, right? And so what do we do about that?
Well, and it's interesting because it's something I've started to see just significant backlash from residents who are not homeless, but, and I don't think this is everybody. I think it's a few folks in a lot of cases, but, the NIMBY thing, not in my backyard. And what I think is so strange is every time that there is an affordable housing building going up in a neighborhood, it often, not every time, but a lot of the time, there's significant backlash from a community. And it's so absurd to me because I think, how on earth are we having a referendum on who gets to live here? Because we do not do this for anybody else that moved into this neighborhood. And the thinking that it's acceptable or okay to say you get to live here and you don't.
And I remember in our pre conversation, you and I were having a little chat about this because I was like, when you explained it in that way, it made me realize it's like if I go to buy a house on a street. And do all the other houses on the street get to have an election to see whether I can move into that house or not? No.
Exactly.
So why do we get that perceived right.
Yeah.
I don't get it either.
And the only way that we can justify that perceived right is if we have a hierarchy of who is valuable.
Yeah, that's right.
Right? And that's inherently, I would say, wrong.
What value are you bringing?
Yeah.
Right?
Yeah.
Which brings me to the next one. Overrepresentation of populations in homelessness is not indicative of an individual's failure. It's indicative of the system's failure.
Yeah.
And I can relate to that hugely, right? Because as someone who's in recovery, you know, I always say, I didn't wake up one morning and say, you know what, I'm going to become an alcoholic today.
Yeah. Yeah.
You know, it's not a choice.
Yeah.
It's a system of things, of trauma that happened to me that I figured out the only solution that I had that would take that fear, that hopelessness, and that guilt and shame away was a drug.
Yeah.
And it worked.
Yeah.
And that just, you know, it just one thing led to another, and there I was.
Yeah.
And this is the same kind of principle. No one wakes up and says, hey, you know what, let's be homeless next month. Yeah.
That's the plan. Gonna write it down in the calendar.
I'm gonna save some money.
Yeah.
Right?
Yeah, exactly.
So what is the system's failure?
Yeah. So, I mean, this is like the thing that drives me in life in general. I used to do frontline social work, and I really felt the need. I love my work. I love doing community mental health. Loved it, loved it, loved it. Also drove me bananas because 95% of what was happening had very little to do with the person and everything to do with the system that was blocking them at every corner. A lot of it with housing and a lack of housing. And to me, on the one hand, I just think so much of what we see, we love telling ourselves the story about individual failure because that fits with the scheme of pull yourself up by your bootstraps, which from a visual perspective is not physically possible. So I don't really understand how that's been a thing that we've all gone along with, but that's an aside.
It sounds good.
It sounds good. Does it though? Like, I don't know. So it's the sort of thing that I find just so frustrating because we love putting that up front and we love this concept of merit, right? And earning things. And we don't think about, you know, well, what neighborhood you grow up in? You know, what access to schools did you have? What access to healthcare? Do you have dental care? Because that has a whole lot of effects on your health in general. Did you have the money to afford your medication growing up? Did you have, you know, the chance because your parents had time to help you get to extracurriculars, which opens all these gateways? Like, there's so many pieces that we like to think we got there because of our own merit. And I think most humans are pretty average, myself included. And to me, like, a truly equal society is actually one where average people can live a decent life, and that we point to these stories of people who have grown up in really adverse conditions and we say, well, like, they got through and look at them doing this, they're a CEO now. And I'm like, but that's the exception. And like most people who are middle class, we're not exceptional. Like we got through it. We had a good,
speak for yourself.
No,
okay?
I'm not at all. And I think that piece is something we don't think about. And so then when you start to understand the challenges of the actual system and have to work within the system. And the thing I compare it to is, anybody ever had a parent trying to get into long-term care? That's maybe the one people can relate to. And then you start to see the cracks.
And it's not only the challenges, but I also see the complexities of it. And it's so multi-layered, multifaceted. And so once again, that goes back to those obstacles, right? In the article, there was a line that said, even before the pandemic, more than 50% of Canadians were living paycheck to paycheck. People are often only one paycheck away from finding themselves without a place to live. And I don't think for a lot of us, we understand that. And coming from a point of view from where I came from, and you know, being an alcoholic and being homeless, and then going into recovery and you know, going to work and you know, to a meaningful job, back into the workforce and whatnot. I lived from paycheck to paycheck for years. And I understand what living paycheck to paycheck is and how stressful that is. Because you know, in the back of your mind, that if something terrible were to happen, you got sick,
Yep.
your business closed down, whatever, you're 1-2 week paycheck away from having to go to your landlord and saying,
Yeah. Yeah.
can I get an extension? Can I get some help? Can you be understanding? Can right?
Yeah.
And so when you say 50% of Canadians are living to paycheck, what type of outlook does that give us moving forward when it comes to homelessness?
I mean, I hope people can see themselves in that. Like, I hope that they can start to think about, wow, if I had, really no kind of beyond the 2 weeks, not really sure if I was going to make it, what that would do to change sort of where they're at. I mean, people probably know, but I often say, like, we have to keep naming how much people make on social assistance. Like, people make, what is it for OW now? It's like
730 or something.
Yeah, it's like,
770.
it's below 800.
Yeah.
And then of course you get, I think it's like 3 something cut if you're not, if you don't have a home. So that's
right.
your rent portion.
Yeah.
I don't know anybody who's managed to get housed for $300 something, but it's not really possible.
Yeah, well, phone Kevin at Jericho Road if you do, please.
I thought you had a waiting list. It's like, but
no,
that's
I meant
it.
for me to find housing for $300 a month.
Okay.
Yeah. And then ODSP, Ontario Disability Support, is $1,170.
Exactly.
And the average 1-bedroom rent in Ottawa is?
I think it's like $1,170. I should know this. It's on our website, but
I think it's
like
$1,170. Yeah.
Yeah. And so that's exactly it. And you start to think about that. And then families, like when you have kids and, those pieces, I wonder sometimes. I find when I talk to people outside the social service bubble, when I'm at a party or I'm chatting with folks, as soon as you just name the hard numbers, people start to get it when they start to just basically do math.
Yeah.
And they're like, how would I ever survive on that much money?
So this is kind of front page for me because of COVID and everything that we've just gone through. And so the Trudeau government gave out $2,000 a month in CERB, right?
Yeah.
Yet, if you were on welfare or ODSP, you weren't eligible for CERB.
Yeah.
So basically, Trudeau is saying that a livable wage is $2,000 a month.
Yeah.
But
we're not going to let other people. Yeah. And I'll give a little bit of, the nuance there is provincial versus federal.
Of course. But the idea behind it is still the same.
Yeah, exactly.
So what are your thoughts on a living wage?
A living wage, you're not asking about Mincome because I have different thoughts on Mincome. I think there's a level, right? We know there's a level that is like basic level of dignity that people need to be given no matter what situation they're in. And I think 2000 may well be it. Like I think we saw something there in that number that seemed to hit, I can survive on this for the time. Okay. I think that changes is, again, if you have kids or more dependents in your home.
Of course.
But I think it gave us a bit of a context for what that could look like. So living wage-wise, 100%. I do think the messiness of this is when we have to look at, I know there's a desire for Mincome for everyone. And I think that you see sort of a mini version of minimum income with rent subsidies.
Yeah.
Bear with me. I know people are like, I don't really know. But rent subsidies, so they top up your rent basically. Yes. And it's like a government program that you can get. And what we've seen, even in communities with high vacancy rates, landlords knowing that that money is out there and the market doesn't respond to the vacancy. So basically landlords charging more because they know they can get a rents up. So there is this tension where there is a level people need for basic dignity. But I think there is also, if you don't do work on regulating the cost of housing or regulating the cost of other pieces, you're not going to be able to get the desired outcome completely. So I think there's a balance that has to be a part of that.
So how do we achieve that balance?
I shouldn't say socialist, but I'm like pretty comfortable with, thanks, Jonathan, I saw a thing. And it's not. I think that actually, and this is getting probably too much, but I do think like socialism and capitalism can actually work decently together in that let's provide the basic quality services that people need that are like in the core of what humans need to function and be able to go and thrive in their communities. So to me, school is a big one. Childcare is a big one. Healthcare is a big one, including dental care and eye care, and housing. And if we got those ones truly compensated for people and said, we're going to make sure that you're able to access good quality, affordable housing, which means a lot more is going to be nonprofit and not open to the private market and speculation.
Can you say long-term care home?
Also long-term care. It's a part of housing, right? It's on that continuum, and people need different types of housing in different parts of their lives. So I think it's that idea that, you know, we get those pieces right, and that becomes the foundation for people to be able to thrive and to be part of their community and to be able to work and to do all these other pieces. But like you said, survival mode, I'm not looking for a job if I don't know if I have a safe place to sleep tonight. It's just not happening. Despite that, many people in shelters work full-time jobs.
And not only that, but I can't contribute to the neighborhood or the society that I'm living in if I'm in survival mode. Because I'm too occupied with trying to survive to live. Here's another one. The fact that people experience homelessness is a cue that we are not doing the best we can for our communities.
100%.
100%.
We can just do better. Like, it just feels so absurd. Ottawa in particular, we're, I think, the wealthiest median income in the country. And frankly, after this pandemic, our biggest part of the workforce in Ottawa is the federal government employees and the high-tech sector, neither of which is suffering during the pandemic. Those are stable, solid jobs. And I think if any city in this country should be getting it right, we should be the city that should be getting it right because of the amount of wealth that is here. And so, I mean, but beyond Ottawa, I think just as a country, countries figured this out. Finland has ended homelessness, and it took mass investments in affordable housing, and it's massive investments in the right things.
So permanent, affordable housing. So it says here is the healthiest and most cost-effective long-term option to dramatically reduce and truly prevent homelessness. So for our listening audience, what is permanent affordable housing? Because we hear it. We hear that three-word phrase all the time. But what is it?
So, and you're not going to like this answer. It's different things for different people, but it's the idea that you don't have to leave. It's the idea that, you know, I'm going to be able to stay here as long as I want and not have to worry about having to find another place. So to that end, like, I know transitional housing has a role to play sometimes, but I also think it's ultimately the safety of knowing that it's permanent and that I have chosen my home and I'm living here. So, I mean, that can be somebody in the private rental market, but who is getting their rent subsidized in order to be able to make that affordable for them. And they may move. They may have, you know, saved up enough to be able to, you know, purchase a small place or something like that. For others, it might be home ownership. For others, it might be, I actually, you know, want to be able to have that sort of safety in like a nonprofit or a co-op. And I think it's that wide variety of different kind of housing options and knowing that it's going to be different for people at different times, right?
You know, I know a lot of people that do live in co-ops, and Ottawa has, I think, quite a few of them.
Yeah, we do.
Why aren't there more?
So this is a funding piece for sure. And I think as well, I mean, if you start to dig into it, there's some great work on the right to housing idea that's happening right now at the international level. And a big part of it is we have a housing market, particularly in Canada, that is, housing has become just a place to accrue wealth, right? You buy a house, you let it sit for 4 years, then you sell it, and in that time, it's somehow increased by $100,000 or $200,000, and you've done nothing. Ottawa's increased by, I think, 25 to 30% in the home ownership market. So then that gets pushed down to every level. So then the people who used to be able to buy housing are now renting, so the prices go up because they have a bit more money. And I think that ultimately the challenge is if everything is driven by the private market and there's not a balance of more nonprofit housing where shareholders are not holding the expectation on the other end of things to make money via rent, you're going to start to have more balance in the housing ecosystem. And a lot of nonprofits need to be subsidized by the federal government to be able to make that happen. And a lot of the time I've heard, you know, a lot of housing providers be like, look, it's not the capital. The building's actually the easy part. It's operating because affordable rents are not going to be able to compensate for the cost of running this nonprofit.
The increase, constantly increasing
Exactly.
cost
Exactly.
and maintaining that building
Yeah.
or buildings for
Because
a co-op.
it goes back on the provider. It doesn't go back on the
Yeah.
individual.
Yeah.
So real, true, I think funding of community-based affordable housing is so critical to making this actually happen. And that also, I think there's more regulation on how we develop zoning bylaws,
Yeah.
how we do densification on the private side. But I think really investing, European countries that have figured this out, you see like 20, 30, 40% of their housing markets in cities are nonprofit.
Yeah.
So I think there has to be a lot more of that if we really want to see changes.
Especially as we move forward in the future, right? Because I know that I was reading an article the other day that said the next generation, which is my son's generation, has a 50% less chance of owning a house in their lifetime, and that's the first time that's ever happened in Canada.
Yeah.
And that blew me away.
Yeah.
Because that's not the Canadian dream,
Yeah.
right?
Yeah. Well, and I think when you want to talk about equity across different racial groups, like home ownership is intergenerational wealth transfer, right? It's the idea that how are people getting housing now? Their parents are getting them a down payment because their houses have increased in value. And that's how you're doing that.
That's what this article was saying about the intergenerational wealth.
Yeah.
Because, someone like me doesn't have that wealth to pass down to my son. And so he's now that first generation that will not have that wealth.
Yeah.
Inherited wealth to be able to provide at least the down payment.
Yeah, exactly.
And that was shocking to me. Shocking to me. One of the things I wanted to talk about, because it's really important to me because we run into it in addictions and mental health all the time, is the stigma surrounding homelessness. So what can we do about that?
So, I mean, I think putting people with lived experience and their voices as an expertise group at the front and center is really critical, and listening to people. And I mean, one of the things that I often wonder is, do we really believe people when they tell us what they need? And I think that's something that is an ongoing thing, especially when you get into a system. It's hard to ask those questions, but I think that's part of it. Is we talk about person-centered care as a buzzword, but I think that idea that this person's maybe asking for an unusual thing, or, but people are different and people need different things. And so I think a lot of the time really zoning in on the fact that this is a person with unique needs is not going to be the same as anyone else. Some of the basics might be there, but really being able to address people individually helps to kind of peel back the layers of what stigma is. And the interesting thing is people, I think in kind of an exploitative and kind of gross way, we tend to really hold up heroes, quote unquote. Like we're like, oh, this person has survived and I'm so inspired by you, right? That story, we hear that. And at the same time, when that person was not doing so well, there can be a lot of judgment and a lot of stigma, right? And so, well, we only like you when you succeed, right? Like that seems like a pretty rough, and I think sometimes one of the things that creates stigma is we're really uncomfortable with allowing people the dignity of failure.
Yes.
Because everybody else is allowed to fail. I'm allowed to fail, and I don't lose my housing. First of all, I don't lose my income. Like I'm allowed to fail, and I have enough of a safety net to catch me, but also, I'm not judged. And I just think when somebody's already had the worst set of blows in their life and they're in a position where they misstep even a bit, like that, the level of judgment and the level of just, no, you don't get the dignity of failure, right? Like, and I think that's what it really comes down to, is there should be space for dignity as somebody, doesn't do the right thing, quote unquote. And in many cases, it is the right thing. It's the right thing for that person.
Well, especially
in the moment.
given the choices that they're facing at that moment.
Yeah.
How do we know?
Yeah.
Right?
Yeah.
So, NIMBY, I knew I was going to talk about it.
Yeah.
Yeah. Not in my backyard.
Yeah.
Yeah.
So, I mean, I think one of the things that that we're starting to see across the country, which is exciting. And I really hope we start to see it in Ottawa. We're kind of gunning for a couple champions, but YIMBY. So yes, in my backyard.
Yes.
And rather than even taking a neutral stance, what does it look like to say, we actually really welcome an affordable housing building into our neighborhood. We think we're the right community for it because we'd like people to be a part of our community, and we'd, I don't know, like to have a community garden and find ways to figure out what being a neighbor is. And I think that's something that actually really can happen. I think we've seen many versions of it with the refugee assistance program.
Yes.
Like, humans get this. People understand what it is to rally around people. And I think we could do that as well. But to shift from, no, we don't want people living in this neighborhood, not just to neutral, but truly to actually, we want to embrace people in this community and make it a community where everybody can actually live, because it makes everyone's neighborhood better when our neighborhoods are diverse. And we just get a better understanding of the world when our neighborhoods are not homogenous, you know? So I think it's really shifting that kind of 180 from moving to sort of this really negative space, but also to how could people be a part of our community and seeking it out. And I mean, I think one of the other things just from a zoning piece with NIMBY that I think does need to happen is right now we do site by site zoning applications. And some communities, I think when they start to see more success, is you set your overall goal for affordable housing, and then you build the affordable housing.
Yeah, there's always a number to it, right?
Right. Yeah. And there's not just, okay, this is going to become a battle, that referendum again for who gets to live in this neighborhood. You change that. I think that's a really important piece that is going to have to change just in zoning bylaws to be able to really see a decrease in that sort of level. And interestingly, there's a great podcast a while ago with Ezra Klein talking about how in a lot of American cities specifically, but I think the same's true in Canada, of quite progressive cities and neighborhoods being the ones that actually block affordable housing and things that I think progressives believe in part because they value consultation, but consultation becomes this opportunity to just say no. And so I think that like alignment is very interesting, but I think ostensibly from people who probably are liberal in their ideas and their values, but when it comes to being in their own neighborhood, think differently about it.
Yeah. Good. Okay. Here's the big one. You ready?
Is it the question from people yet or
no?
No,
No, it's the big one from me.
Okay.
What can we all do?
Okay. So it's funny because I feel like I haven't actually talked at all about communities are ending homelessness. It's a real thing. It's happening across Canada, and it's really important for people to think about examples. So Edmonton has reduced homelessness by 43%.
That was the city.
The city?
That was the city.
It's my go-to. They're the same size as Ottawa. They're actually bigger. And they've done it by what I would say is like a huge culture shift. And one, starting to think of resources as collective across all agencies. How do we use our data and our collective resources to figure out how to help people move through the system? Coordination is a big, big piece of that. And then I think with like a relentless housing first focus. So you know what, you're going to be in survival mode until you have a safe place to stay. So let's focus on that, and then let's focus on the other pieces. But those pieces have really been kind of the pillars of changing how they've dealt with things. And Edmonton is one. Alberta in general actually is like the winner in Canada, I would say, for seeing significant changes. And part of it being in a city that has we're a very bureaucratic city, as we all know. We tend to be risk averse. And I find that Albertans from the cities, and I've had a chance to work with a lot of these communities, there's just a willingness to give it a shot, just to try something and try things that are new.
There's nothing wrong with rolling the dice.
And I think the head of the Canadian Alliance on Homelessness talks about don't let perfect be the enemy of the good, right? And I think we get stuck sometimes in trying to do everything perfectly that we end up doing nothing. And so a lot of the Alberta communities, Medicine Hat has effectively ended homelessness. So people still become homeless, but they're rehoused into permanent housing within, I think it's under 5 days now. They've done an amazing job. Same with Calgary. They had the largest homeless shelter in North America, reduced their numbers by about 50% in 2 years. And that was by again, this relentless focus on getting people housed, and the supports that come with it. I think that I haven't said that, and I should say that. It's really important.
I was going to jump in when you were done
yes.
and say, along putting the roof over the head is the first step, but having that support network behind it.
100%.
Because, for my experience for myself was, it's great that you gave me an apartment, but if I didn't have the mental health support and the recovery support, and then the social service support and the food support and all those things to go with it, I wasn't going to survive anyway. So it's multifaceted, but I mean, we need to start somewhere, right? Yeah.
Absolutely.
And that's the same with food insecurity versus hunger, and a lot of us don't grasp that whole idea that if I'm not eating the right food, then I need more dental work, I need more visits to the doctor, so I'm not getting the right nutrition, and on and on and on. And the same goes with the housing, right? If I don't have that roof over my head, then I'm not getting access to those services and those systems that are out there. Yeah. What else can we do?
So, I mean, the thing that I know people always are like, oh, everyone tells us to do that. But I mean, at the end of the day, I'm not going to blame things on the government because we elect governments and governments respond to what voters want. And when voters say enough is enough, nobody should be homeless in a country as wealthy as Canada. If we made that an election issue, you don't get in unless you take this seriously, and not just by investing in private development only, which is what we've seen a lot of. That's what changes the tide. That's what actually gets it done. And I think that you look at some of our biggest crises happening in the world today, climate change and housing, to me, are sort of the two that I think of. If there's no planet, all the other issues are irrelevant. And if people aren't housed, what housing can do to, exactly as you said, all of these other major social issues, if people are housed, it actually prevents so many more social challenges.
And not only that, but for the average person, let's talk about the money. We either pay for it now, or we're going to pay 10 times more later. So, let's stop quiggling about the money. Because, the studies are out there, the research is out there, that if we don't start addressing these issues right now, they're going to cost us far more in the long run.
100%. Well, and I wouldn't even say the long run now. A rent subsidy is like $700 or $800, and you look at the price of what it costs for one family in a hotel to be staying, is about $3,000 a month. $3,000 versus $700. So it's a huge cost. And I think the frustrating thing is, shelters are all trying to do housing. And their housing is cheaper than the shelter costs, but they need the funding pathway to get them to be able to do more and more of that. And so I think that's a really key piece. But again, it all comes down to your city councillor, your MPP, and your MP have to be on the hook. Like, don't let them off the hook. Call them, bug them, call them again, leave messages, get other people in your neighborhood to say that it matters. And I think every level of government, I like to kind of break it down. The feds invest in like buildings and capital. Really, when the feds stopped doing that, that's when we created homelessness. The province invests in services, and they have the money for operating costs and services, and we have to push on them for that. And municipally, it's all zoning. It's all about zoning regulations. And I think a lot of the time other levels of government like to point at each other and say we can't do anything except for what the next guy does. And the reality is even the city government actually has more tools in their toolbox to get these things done than we like to know. They don't have much money, I'll give them that, but there is a lot more that each level of government can do than is doing it.
And so if you don't understand what levels of government pointing fingers at the other looks like after the past year, then there's a problem. Right?
We've had a front row view.
Wow. Okay, you ready? Question
and
answer
now I'm
period.
nervous.
Question and answer period. We don't have any questions.
Okay.
Isn't that fabulous? That means we did our job.
Okay. I don't know if that's what it means. I'm like, I feel like I had a lot of things.
No, I think that means that we did our job. Okay, before we go, I have a couple of things. You ready for this? This is a quote from a client at a homeless shelter. He said, "Homelessness separates you from society. Really, you do become separated from society because you don't live the same as other people."
Well, and I think that's the biggest thing, right? Homelessness is just a vehicle for isolation.
Yeah.
And that's the piece at the end of the day. Because I know sometimes people talk about somebody moving in to a home and then moving back to a shelter. And I think at the end of the day, humans will do anything to not experience loneliness. Like isolation and loneliness are the thing that I think at our core is potentially the most lethal.
So we say in recovery, isolation is a killer.
Mm-hmm.
It kills us.
Yeah.
Yeah.
Yeah. And you're seeing governments actually start to get that a little bit.
Mm-hmm.
Like England has a Minister of Loneliness, which is a really terrible title, by the way.
Yeah.
But this recognition that actually loneliness has all these severe social health consequences.
Mental health consequences. Yeah.
Exactly.
Yeah.
And so I just think, certainly in frontline, there's a lot of language thrown around a person who's like, well, they're trying to get attention or they're trying to do this. And I'm like, they're trying to exist. Yeah. They're trying to be recognized as existing. Yeah. And all of us do that. And all of us
we want to
be
heard.
Yeah. We want to be heard. Exactly.
Yeah. Mm-hmm. Okay. I'm going to give you a minute. You ready?
Mm-hmm.
Do you have anything you want to talk about?
Anything
that I missed?
There's no time to talk about this, but I actually wanted to talk about trauma.
Oh.
And yeah, I know 10 minutes left. Super easy peasy.
Wow.
But just for you to speak to the role of how trauma factors into addiction, because I think it's something that I thought everyone understood, and I realized that everyone does not understand. And just how much it's that question. I know it's being said more and more, but rather than saying like, why did you do something? It's like, what happened?
Yeah. So we at Jericho Road, we're very, very big in advocating on what trauma is and what trauma does. And about 4 or 5 years ago, a bunch of scientists got together from different places in the world, and they realized that trauma was a major contributing factor to our social lifestyle, our mental well-being, our physical well-being, and they have this thing called the Adverse Childhood Experiences Test. And it's a series of 10 questions. And the more questions you answer yes to, the more likelihood you are to have smoking cigarettes as an adolescent, to committing suicide, to using substances on a daily basis, on and on and on, having heart attacks and strokes and whatnot. And what they found was that the average person has 2 adverse childhood experiences. And an adverse childhood experience is a traumatic experience. Now, it's a perceived and real traumatic experience, because what may be traumatic for me may not be traumatic for you, and vice versa. And what we do know is trauma not necessarily is the event or the action that happened, but how you respond to it and how it's affected the inside of you. And so we know that trauma is a contributing factor to a whole bunch of things, but the main one being substance use.
Yeah.
And because we have had something or many things happen to us as individuals, usually between the ages of 3 and 12, and we've never been able to process those events or deal with them.
Yeah.
And so we end up living in constant states of fear, of guilt, of shame, resentment, and the only way that we deal with that is through substances, because we've been introduced to something that has taken those feelings away, albeit for a short period of time.
Yeah.
They've taken them away.
Yeah.
And luckily our government now has put those on every corner with liquor stores, beer stores, and now pot stores. And so instead of providing the teen or adolescent with the right mental health and help and recovery to deal with those traumatic experiences, we've allowed them to go and figure it out on their own. And the quickest and easiest thing are substances. And those substances can range from many different things. a lot of us deal with our trauma through other substances. With gambling, shopping, food, busyness.
Yep.
The more severe the trauma, the more trauma that has happened in an individual's life, the more likely they are to use substances because the pain is so strong that they need something other than buying a lottery ticket or eating a Big Mac to take that pain away.
Yeah.
And so we really understand that it's like we were saying earlier in the podcast, no one wakes up in the morning and says, I'm going to become a drug addict today. No one does. Who would want that?
Yeah.
I wouldn't wish that on anybody.
Yeah.
But faced with living inside of my head and the constant fear that I'm experiencing from the time I wake up to the time I go to bed, bring it on.
Yeah. Yeah. And I think, and we may land in slightly different areas on the harm reduction spectrum, because I do think it's helping, it's keeping people alive.
For sure. For sure.
But I think that idea that in those different stages, people are doing the thing that makes the most sense based on what's gone on.
I don't disagree.
Lives. Yeah.
I don't disagree.
Yeah.
Because I don't really have any other choices.
Yeah.
And unfortunately, our healthcare system, and I praise this country all the time that we do have a beautiful healthcare system. It's not without its faults, but there are a lot of merits to it.
Yeah.
But trying to get someone who's come to Jericho Road the necessary mental health support that they need can be a year to a 2-year process.
Yeah. Yeah. Well, and even separating, substance use from mental health is so weird, right? Like it doesn't make any sense because people are whole people.
That's right.
Complex.
It's all the big ball.
Yeah.
Right.
Yeah.
And the models that we're realizing now that don't work. The models that came from years ago were that addiction had to be treated by these people and mental health had to be treated by these people. And we know now that they go hand in hand. Yeah. It's not a separate issue.
Yeah.
It's we have to take a holistic approach to this and treat the whole person.
Yeah.
Right?
Yeah. Exactly.
So it's another battle. And part of that, as we go back to what you and I talked about, is we need a roof over our head to get those things started.
Yeah. Basic needs, right? Like we've all had potentially a parent or somebody like a caretaker be like, when you're hysterical or when you're not doing well, have you had sleep? When was the last time you ate food? Like when those basics, right? Like
hungry, angry, lonely, tired.
Exactly. Halts. Like it all comes back to those basics. Yeah, exactly. And just like, we're pretty basic when it comes down to it. So we don't take care of those pieces. Yeah. Yeah. Yeah, absolutely.
Well, listen, I have thoroughly enjoyed this time.
Thank you.
I just want to thank you from the bottom of my heart for coming here and doing this. And I think not only did I learn a lot, but I'm hoping that all our listeners are going to learn a bit more, because once again, we can't all do this on our own. It takes a community and it takes a neighborhood. And I'm very pleased that Jericho Road is a part of the Alliance to End Homelessness, because I know that it's going to take all of us.
Yeah, 100%.
And there is a solution, right?
Yeah.
There is a solution.
It's a million different solutions that equal a big solution. Yeah. Thank you so much, Kevin. I really appreciate the conversation. And this was a very cool format to actually just have a chat, really, about these different pieces. Yeah. So thank you.
You're more than welcome. Thank you, everybody, for watching. Remember, for our Voices in Recovery podcast in 2 weeks is Darcy C., and I'm really looking forward to having him on. I know there will be a few laughs and maybe a few arguments, but nonetheless, it will be entertaining, trust me. And Kate, once again, thank you. God bless you, and keep up the good work that you're doing.
Thanks, you too.
Okay, bye-bye.
Bye. I don't know where I'm waving.